Thank you very much. So I was given the task of where to from here with all of this. So I guess the bit challenged. I'm not the amazing Kreskin. I'm not a clairvoyant. I don't know what's really going to come. But what I thought I'd do with this portion of the talk is just give you a glimpse into Alberta Innovates and what we're seeing in our strategy. Give you a glimpse into some of the challenges that's facing the healthcare system today. And then just think about how the unit and how the supports and the infrastructure and the strong skills strategy that Marilyn alluded to and the accomplishments that Lisa alluded to and then the personal story that Jane revealed would actually come together and be part of that future. So I'd first of all like to acknowledge the Alberta Sport Support Unit. We've talked a great deal about today, and I do believe that the people are the strength of the Alberta Sport Support Unit. It is the people capacity and those skills coming together to provide that expertise to the community has been a great asset that's been built in Alberta. I'd like to thank again the Canadian Institutes of Health Research, which has done a great job of advancing the strategy nationally. And again, it is part of a $500 million strategy. So it's actually, there's many, many component parts to this that are all coming together and converging into the next phase. I'd like to thank Alberta Innovates because that's the home base that we had. And I guess from my point of view, I joined Alberta Innovates in 2013 in the summer. I had lunch with Dr. Cy Frank, and he had a very persuasive way of talking about the opportunity, very passionate. And he said, you know, if I got a job for you, could you do that job? You'd be great. And I said, no, I can't do it, Cy. And he said, nope, you have to do it. I'm not going to take no, you're going to do this job. So from that moment on, we've been involved in this unit and moving it forward. So with Alberta Innovates, though, we've gone through a lot of shifts, right? So we've been, we were the Alberta Heritage Foundation for Medical Research. Maybe some of you in the room know that organization. We then shifted around 2010 to the Alberta Innovates Health Solutions. And then in 2016, we were consolidated under the Alberta Innovates banner. And that really brings all of the research and innovation across the province under one mandate, under one roof. So now we have one board that's cross-sectoral, so we not only deal with health, we also, I was in a meeting this morning, for example, on clean technology and data, on looking at digital technologies for the digital oil fields. That's an example of things we get involved in now at Alberta Innovates, and it is cross-sectoral. We have technology futures, and that brings us into the artificial intelligence realm and machine learning realm, which is really part of the whole thing. And we also have biosolutions, which really are the foods we eat. And so, of course, there's a lot of interface between the foods we eat and our health outcomes. And then we have the health piece, which I'm responsible for with my team, and we drive the health solutions portion. But what we're really seeking to do is really three things. Achieve results is the first mandate. So we want to invest for results and outcomes. Number two, we want to collaborate and partner with everybody. Okay, it's going to be science is now a team sport, and everyone has to be involved in that, and that includes patients in that partnership. And number three, digital technologies are the table stakes moving forward into the future. And that's not just in health, that's across all sectors, and every aspects of our lives are being impacted by that. But those are the three core things. And then we're looking to embrace emerging technologies as we do that. We're looking to enable strong skills strategies and a strong people strategy into that future. And then we're embracing ourselves a digital future. So that's sort of the gist of our strategy at Alberta Innovates. But I think you're hearing a lot of themes that I heard already mentioned around building capacity, building people's strengths, building skills as sort of a rising tide that would lift all boats in the harbor, right? So as we do that, I think we have a great opportunity. We're positioned quite well for that future with the Alberta Sport Support Unit. This slide, again, just talks about the issue of how we view our investments around discovery, develop, and use. And you may have heard those expressions before in different words, but that's the way discovery research is done. Then there's development of the products or the innovations, and then the actual deployment or use or scale and spread of that into systems, right? So we do that for outcomes, and we do that ultimately for impact, and that's the theme of this conference. And I think oftentimes my observation over the last number of years in this is that we focus on the inputs and the outputs, and we focus on the count, but we don't necessarily focus on the outcomes or the ultimate impacts that that's meant to achieve, right? We have that in high level, but we have to do a good job, maybe through this conference and other conferences, we'll get really good at linking the impacts we're hoping to achieve with the outputs we're producing in the unit. And the more efficiently and effectively we can do that, I like our chances better moving forward. But this just basically says we're building capacity, as Marilyn has said, in people, right? We're building that capacity development. And into the future, that will be a strong theme. As Serena knows, every time I've heard the new president and CEO of Canadian Institutes of Health Research speak, I've heard him speak about 6 times, he mentions capacity development every single time, right? He's thinking about a 30-year long game of how do we build capacity for the future, how do we build those people's strengths. So again, I think we're really well positioned in the Alberta Sport Support Unit for that future. I think we should be advancing some of our certificate programs as offering up as potentially national things that could be picked up and used by other people. So what's the driver? What are we trying to do? Why do we, I mean, we talked about the research side of the equation, but what was the big driver, I think, from my point of view, was relevance. Relevance of research to citizens and to patients, right? So, and how that all takes place. So this diagram just talks about the translational research gaps across the continuum. And this came from an article I read probably about 2014. It came from Jonathan Grant from the UK. And the title of the article was, The Answer is 17 Years, What's the Question? Right? And the answer to the question was, how long does it take for discovery research to have an impact on patients in practice? So he did a study of all the various things, and he came up with a worldwide answer. The answer is 17 years. Well, that's too long, right? So one of the things that this diagram really shows is that there's discovery research that happens, right? And that's novel invention. It then gets, there's a gap between the discovery research and the clinical validation of that research. They call it, in this one, gap 1. Different people call it different things in different countries, but there's a valley of death there, right? And then from first-in-human clinical trials to health services research to outcomes research to comparative effectiveness research to impact, scale, and spread, there's another gap, right, called gap 2. And the SPORU strategy was designed to address gap 2. That was what it was meant to do from the original. That was the whole intent. And how can we shorten that gap, right? So right now, it's not all 17 years resides in gap 2, but how can we shorten that gap with data access, with methods, with supports, with trials, with methodologies? How can we make things more efficient in the research enterprise? The new gap that's coming, and Lisa's expert in this, and the gap between implementation and impact is really the gap 3, right? And that's why people have heard, if you heard the expression, we have to scale and spread this innovation into health systems for practice, right? So that one really focuses on implementation science and policies and practice and how best to bring that together. And I believe that this is something into the future again. I think that as we look at what's coming from the SPORU strategy and the results from the first 7 or 8 years into the strategy for CIHR in the country, I think that gap 2 and gap 3 really provide the most fertile ground of where we can make the biggest difference. And especially in Alberta, right? With our One Health Authority, Alberta Health Service, with our good data sets and good data availability, we really have no excuse but to actually be able to address gap 2 and gap 3. Doesn't mean gap 1's not important. Doesn't mean it needs to be looked at. But again, we have to think about where SPORU would play the most. So again, looking into the future, I think that'd be something we can work on. So where's the opportunity? This slide just talks about, so this talk today is probably, we've been at it for about an hour, I guess, maybe, right? So today's, in that hour, Alberta Health has spent about $2.5 million on healthcare. Okay, so by the end of today, we will have spent $60 million on healthcare delivery in Alberta, right? At the end of this year, it'll be $22 billion in expenditure, right? So and actually Alberta is the highest cost per capita in the country, right? So this slide just shows the country about how the cost of healthcare spend is outstripping our gross domestic product and our ability to meet that. So at Alberta Innovates, we see that as economic opportunity. There's an opportunity to help close that gap. And that percentage has been increasing, You see the stat, 191% increase in healthcare spend from 2000 to 2016. So Alberta leads the country in spend in that regard. Okay? So that's an opportunity. Okay, those are just the facts. And you might say, well, these are old numbers, Tim. You know, that goes to 2015. It must be getting better now, and it must be self-correcting itself. No, it's not. It's actually going the other way. So I was at an economic roundtable about 2 months ago, and an economist from the University of Calgary presented stats about the impact of the aging population in Alberta, right? Just aging alone. So presently today, 12% of Alberta's population is over age 65, and that's going to double by 2040. That doubling of the aging population will put $6 billion of cost on top of the current system, right? So as we look at what's coming down the track in Alberta with the new government, and as we look at the cost savings in healthcare, think about that as the pressures are the other way. So therefore, this is where I think economic opportunity comes into bear. This is where innovation and research can really add value to the system and to patients, okay? So you would think this is a stat that talks about the outcome indicators. You would think for all that spend that we have the best outcomes in the world. If we're spending the most, we must be getting the most outcomes in relationship to that. This is a study of the OECD countries, comparing 11 countries in healthcare. And you can see of those 11 countries that Canada comes 9 out of 11 for health outcomes. And Alberta contributes to that proportionally to those outcomes. So again, we spend the most, we get mediocre outcomes for that spend. But again, that represents an opportunity, I think, in terms of helping advance our systems. The Alberta Sport Support Unit, as you've heard, I won't go into repeat what everyone said, really offers those services up to the research community to help bring innovation, to bring research, to bring policy to bear, to bring practice to bear, to figure out what works in what context and why in implementation science. And combined, those people infrastructure really can add value. So again, into the future, that's a really key component, I think a really key building block as the government's search for answers. And don't take my word for it, I won't go into repeat, but this is Catherine de Beaupré. She was part of the Depression Priority Setting Project, right? And the key thing in this quote for me was, she really got reciprocal value from being involved. She got a better appreciation of what the researchers and what the clinicians and what the system was dealing with as being involved. And that's a value too as we move forward in our studies. It's not always a one-way street in terms of patients being involved in those studies. Melanie Knoll, met her at a conference for chronic pain in children. That's her area of study. She's availed herself of a lot of the supports, and she's very much getting involved in terms of getting grants, working with, and it said it was a great gift to the research community to have these PhD-trained people available and on tap. So again, a young investigator just starting off from her career, but she's really valued the Alberta Sport Support Unit. And she's a converted customer to our services. And again, we can build upon that because the things that come out of her research can really have an impact and really present an opportunity. And Lisa's already mentioned Scott Garrison with the BedMed project, and I won't repeat all the thing, but the thing that stood out for me here is the quote, "I would never go back to doing research any other way." And I hear that all the time from those who have used the researchers out there. Now, we need more Scott Garrisons in a way in Alberta. We need to start converting more researchers to that way of thinking. I still think in the future, again, I was asked to talk about where to from here. I do think we have more a market of researchers who we can target and help convert them into this way of thinking, because I do think it adds a lot of value for all the reasons that Lisa mentioned and all the reasons that Scott put in his quote. And he genuinely means that. I met Scott at the SPORE Summit in Ottawa. He was there at the National Summit, and he doesn't just say those things, he actually walks the talk. And again, I've heard that from many researchers across the province. So looking ahead, what I thought I'd do just briefly is just take people on just a bit of the opportunity and what I think is coming. This is more of the healthcare as opposed to the health research of the SPORE side of it, but I just want to put this out for you to take a look at. This diagram really is a 2x2, so it has on the right-hand side, it has clinical environments, so hospitals where people provide most of the care. On the left-hand side, you have community venues. okay? On the upper side, you have medical care, and on the bottom of the y-axis, you have social interventions, okay? And this came from just a model that was really helpful for me because it came from Stacy Chang from the US, who's a design thinker. He thinks about health systems and how best to move this at the University of Texas. So first of all, hospitals are in the upper right-hand quadrant. They're heavy clinical environments and they're medical care. So as Jane said, you have to go to those environments, and Marilyn mentioned that too. The parking at USC is lousy. I would agree with that, by the way. But we force people to come to those environments, right? To be in those environments to get the care, which again, kind of seems counterintuitive to how things are happening today, doesn't it? We then have outpatient clinics that again are heavy, fairly medical care, which are more clinical environments to come to, but again, you have to come to the environment, okay? We now have building up what I call healthy communities. People have heard of health cities and smart communities, and these activities are really happening more and more on the fore, and so these healthy communities are being developed, and they're being developed and designed with healthcare in mind, right? Not solely, but as part of its activity. Community care providers are people that meet you in your home, so home care providers and allied health professionals who work with patients, whether they be, either before they get illness or even after they get illness, and they get the care they need. And the last thing is the connected home, which is where people want to stay, right? So when I worked for 12 years, I worked in cancer care in oncology at two, Princess Margaret Hospital and the BC Cancer Agency. And I was responsible for the inpatient beds in those two facilities. That was the last place people wanted to be. Okay, patients didn't want to be in an inpatient bed in our facility, right? So, but we were downstream, and that's where all of our resources were, right? That's where we provide that's when the care system really kicks in. When you're diagnosed with cancer and you need an inpatient. I mean, thank goodness it's there when you need it, but that's the last place people want it to be. So I've often thought, could we go upstream and help prevent people from getting the need for this facility in the first place? And our vision as an organization was a world free of cancer. So our vision was to eliminate ourselves, actually. That was the whole goal of our organization, to eliminate the need for that inpatient unit. So again, that's moving forward. Oh, a minute. Oh. So we have current models and we have new capabilities and capacities, but then we see the opportunity is really digital and data moving forward on that continuum and helping do that. And again, because the technologies allow that to happen, and in every other aspect of your life, it's more personalized, it's more connected, it's more individualized, except for healthcare, right? Where people come to the environment to get the care they need, okay? So we see disruptive innovation and emerging technologies as being an important element from Alberta Innovate's point of view. That's into the future, and that will happen more and more and more. So something, again, for the SPORU to think about. But the big thing, just to finish up, is what's required, I believe, is convergence and integration. I think I see a lot of things that stay in. So we've already referred to the silos of research, right? So things stay within the research project and good information. Actually, it's Marilyn's filing cabinet, I think, where all the research, all our good ideas go, right? So that's a silo in a way. That's in the research realm. You may have got a paper out of it, but that's where it sits. Innovation is about implementation and how you move things into impact, right? And how you do that. Quality improvement, it's about improving the quality of care, and I think sometimes that becomes a silo inside health systems, so health systems view their activity as what they do within their own domain. And last, operations management, how the health system is ran tends to be its own silo, and again, those communities don't naturally coalesce and interact. But I would think the bridge between those four silos is really where, again, the Alberta SPORU support can help underpin that. That would be a great advance for our future. And I'll do one more plug before I give up. We do have a research innovation assessment course in Banff. Speaking of, Marilyn mentioned Banff. Not plugging Banff. We get no kickbacks from the Banff City Council, by the way. But the Inventures 2019 is our signature conference, which is happening June 7th to 8th, 2019. And then we have 5 to 7, 2019, and then in the trenches is the Impact Summit back in Banff on the weekend. So a whole week of courses. So if you're interested in any of those topics and you'd like to go to Banff or Calgary for Inventures, it's our signature conference to move it forward, and we'd appreciate and like you to be there. Thank you very much. I'll stop. Thank you.